Yeah, good morning, everyone. Welcome to Light Red podcast series, a joint initiative by NATCO and Voice Healthcare team. Light It Red is nothing but the podcast platform dedicated to spreading awareness, sharing stories, and bringing hope to the people who have been impacted with blood cancer. As you all know, every year millions of people are getting diagnosed with blood cancer and conditions like leukemia, lymphoma, and myeloma. Yet too often, signs and symptoms are ignored. So go unnoticed. So today we have a renowned Dr. Subhaprakash Sanyal, Director Haematology, and also bone marrow transplant physician with experience in cellular therapy from Fortis Institute of Blood Disorders, Mumbai. To understand and explore what actually blood cancer means, sir is with us. He'll also share his knowledge on diagnosis, treatment in blood cancer. While we go, he's with us. We explore our multidisciplinary care and clinical research in shaping the future of blood cancer therapy. It is always honored to have you on this platform, sir. Welcome, sir, to Light Red platforms. Welcome, sir.
Thank you.
Yeah. Sir, when we talk about this blood cancer, what actually it means and how it is different from other types of cancer, sir?
So in our body, there are different type of system, right? Respiratory system, gastrointestinal system, genitourinary system, hematology system, right? That different type of systems. So when the hematological system get affected by cancer, it is called simply the blood cancer. What is the element of hematology? Hematology elements are three. It is the RBC, red blood cells, white blood cells, and the platelets. So when these elements get affected by the cancerous process, we call it is a blood cancer, or blood cancer is almost equivalently called as leukemia. So generally the three type of blood cancers are there. One is called leukemia, one is called lymphoma. Lymphoma is a cancer of the lymph node. And in bone marrow, there is another type of cell, what is called plasma cell. When these plasma cells got cancerous, we call this as a multiple myeloma. So most important thing about the blood cancer and the other part of the cancer is little different. So blood is flowing everywhere in the body. And most of the time, most of my patient ask me, sir, what stage exactly we are in? So blood flows everywhere. So in blood cancer, stage does not matter much, but more important, type of the disease matters. Like an acute myeloid leukemia, when we talk about that, there are three type of acute myeloid leukemia, like a good risk multiple myeloma, intermediate risk, or poor risk. So different type of disease we can identify with the use of newer logistics, and that is the way it is different from the other part of the cancers.
Okay, sir. And who are generally risk? Means there is any particular age or any other risk for developing this type of blood cancer, sir?
Yeah, so in blood cancer, generally there is no very defined risk factors associated, like a smoking causes lung cancer, nothing such exists. But yes, the people who are exposed to chemical factories, people that used to work with a lot of pesticides, people used to work in the atomic reactors, they are known to develop blood cancers.
Sir, anyways, we'll discuss later on the diagnosis and treatment part. But still, are blood cancer curable, sir, or can only be manageable?
Yeah. So many times when I travel in my Uber or Ola, the drivers ask me, what you do? I told I'm a doctor. Then they ask me, what type of doctor you are? I told I treat blood cancer. Then the very next question they ask me, sir, blood cancer kabhi cure hota hai kya? So remember one thing, blood cancer is a very well curable and very well manageable disease. Many of the blood cancers are now completely cured and completely conquered in the latest technology of the treatments available. So remember one thing, yes, it is true, all blood cancers are not yet curable, but most of the blood cancers are very well curable with the newer logistics of treatment.
Okay, sir. Thank you. Okay, sir. Thanks for giving the idea on the basics part. And when you come about understand the burdens, sir, what are the trends and increasing incidence in the blood cancer, sir, in India?
There are two aspects. India is one of the most populous country in the world, right? So when the number
Yes.
of population is more, number of people is more, automatically the burden of cancer will be more. compared to any country where the population is less, right? That is one thing. But at the same time, the improvement of the diagnostics, improvement in the awareness, many people are actually seeking medical help quite early nowadays. So diagnostically, definitely we are doing good, but we have to do much better down the line so that we can pick up the diagnosis more easily and more faster approach. That is the thing I believe.
And for example, sir, some is a, as you already explained about the risk factor, all those things, but still any some lesser known risk factors, anything which pertaining to blood cancer, sir?
No,
Any other
in
risk?
generally no. So people ask me, I have never taken any non-veg food. I never smoke. I never drink. Why I am getting this problem? So honestly speaking, there is no actual habits is linked to blood cancers. So this is basically a myth, little bit.
Yeah, okay, sir. And coming to the diagnosis part, sir, do you think, as per your expert opinion and expertise into this, do you think early detection is very crucial in blood cancer, sir?
See, early detection always is crucial, no doubt about that. But most important thing is the challenge in the blood cancer. What I believe that when you talk about the blood cancer, people think it's a very big disease. Something happened, so you can expect a lot of symptoms, lot of problem in your life, and that will compel you to go to seek medical advice. Actually, it is not so. Blood cancer symptoms are very non-specific. Like you are getting fever, not is getting controlled with the standard antipyretics like a paracetamol, not getting controlled with antibiotic. You are getting loss of weight, which is happening for last 5 6 months. You are not able to eat properly. You are getting some swollen glands in the neck or axilla. So these are very non-specific symptoms. Sometimes, most of the times, brought you to the hospital setup, and we do some routine checkup. And one fine morning, I tell you, okay, your peripheral smear shows blast cells. You need a bone marrow test. Probably you are suffering from the blood cancer. That will become a very blow to the patient. So remember one thing: blood cancer symptoms are mostly non-specific. That is very important. So don't neglect if you are getting fever continuously on and off, you are getting significant weight loss, you are not feeling well, you are feeling very tired, fatigue, you are getting bleeding spots here and there, you are getting some swollen glands here and there, then you should visit some qualified MD medicine doctor or hematologist at least.
Okay, sir. Okay. Sir, for example, what are the screening recommendations for the person who has already have a family gene is carrying the cancer? Is there any different recommendations?
Look, one thing is very important: blood cancers are not genetic in nature. Okay. So I don't make panicky of my patients that your sibling, your brothers, sisters, your son and daughters to screen and all these things. So honestly speaking, I don't recommend something extra for them. But only one type of blood cancer that we call CLL, chronic lymphocytic leukemia, that is believed to be familial in 10% incidence. So familial means what? That means it runs in family. No genetic marker or genetic mutation is identified, but it runs in family. Suppose I have the disease, so it may chance that there are significantly little more risk of my the siblings or my kids. That is the whole thing. So I tell them to do after 40, 50 years, do the routine health checkup, like do CBC properly, and this basic biochemistry is more important. I am not very keen to do screening blood cancer or try to identify the blood cancer from the without any symptoms or something like that. But yes, as usual, now the awareness is increasing. People are doing health checkup in different way. Like many of the offices allow the many of the corporate institutes allow them to go for the health checkup. So normal CBC and the blood chemistry is more than enough.
Okay. And coming to the treatment and innovations, if you talk about, sir, how is the treatment landscape been evolved in last 20 years or last 10 years, sir?
So if I summarize the treatment evolution in the last 3 years, there are two aspects that are happening, which is in big way. So, number one, to prognostic the disease. Whenever we talk about the blood cancer, you ask the first question, is it curable or manageable? What it is? The patient wants to know that, okay, I'll spend the money for the disease, whether I'll be curable or not. So, most important, with the help of the few tests, what is called cytogenetics, what is called FISH, what is called next gene sequencing, we now understand the disease more better way than previously. So, like acute myeloid leukemia, simple, same disease. One patient gets a acute myeloid leukemia with a mutation called NPM1, which means the disease is very easily curable with a standard chemotherapy treatment, right? If we get another patient with the same age, an acute myeloid leukemia, with called TP53 mutation, that means it is extremely bad disease. So now we are understanding the disease more and more better way. You can call it personalized medicine. You can call it the precision hematology, that every patient are different and every patient is looked into different approach. Another thing is coming in big way in hematology, hemato-oncology at this stage, that the many patients, what we are getting, we are trying to understand the disease more deeper and deeper with the understanding of the biology of the disease. And that gives us a lot of perspectives to treat the patients differently from each other. That is the most important thing. We are moving from chemotherapy to the non-chemotherapy era. So we are moving from the conventional chemotherapy to non-chemotherapy era, like in multiple myeloma. Now the total treatment approach is a non-chemotherapy approach. We are using now the proteasome inhibitor. We are using the immunomodulators. We are using the monoclonal antibodies. We are totally moved from the chemo to non-chemo journey. Acute promyelocytic leukemia. Our entire treatment is now arsenic and Atra tablet based. So that way things are changing. Like AML, we have a significant options of the non-chemotherapy options like azacitidine, venetoclax. So lot of monoclonal antibodies are coming. You can call it them as a targeted therapy. That gives us a more better result, more precise result, less side effects, better control of the disease. Like a simple example, like a acute lymphoblastic leukemia, when it relapsed, it is believed to be extremely difficult disease. But with the help of a drug called ionituzumab, now we able to control the disease very efficiently, and then the patient can go and move to the bone marrow transplantation. That takes a cure significant number of the patient. So these are the area we approach lots, and these are all available in the country. Number two, the improvement in the bone marrow transplantation, supportive care of the bone marrow transplantations. Lot of good qualified people are coming in the bone marrow transplantation, and the most important, a lot of centers are coming in the country throughout. But still, we are far, far short of doing the bone marrow transplantation. So there is a population dynamics. So if you believe in the American population, US population, the US around 40,000 bone marrow transplantation per year. But we are doing at least any entire country, we are doing around 3,000, 3,500 bone marrow transplantation, which is still far, far less. So these are challenges are there. And the most important innovation in the CAR T cell therapy, which is immunological therapy, which gives a lot of hope to the relapse setting of the acute lymphoblastic leukemia, particularly B cell type and B cell lymphoma. So a lot of things happening, lot of churning happening. I think the coming years, whatever we've seen last 5, 7 years is excellent, and I'm sure the coming 5, 10 years will be more exciting.
Thank you, sir. Thanks for highlighting the treatment evaluation part. But, sir, your voice is clear, but your picture, Sandesh.
Yes, Sandeep. Yes, Sandeep. Please tell me.
Uh, sir, voice is very clear and very, mean to say, understandable. But, sir, picture is going and coming. Can you?
No, no. Like sometimes it happens, Sandeep, because of like network issue. Like sometimes there is a
Okay.
network issue at your end, or maybe. So please continue it because it's a live.
Okay. No issues. Okay. Thank you.
Okay.
Okay, sir. Sir, you talked about BMT, you talked about targeted therapy, you talked about understanding the biology, sir. But still, sir, one more thing is that I think CAR T cell therapy, is it also a promising therapy in the coming years, sir?
CAR T cell therapy is already establishment treatment in the hemato-oncology. It is approved, it is proven, And with the help of the Indian CAR-T, our cost of the CAR-T cell therapy is drastically come down from the Western world. In India now, two company which is licensed, DGCI approved. One is called Immuno Act, one is called Immuno Nil. So we can get the CAR-T products for our patient. Particularly, I told you, relapse setting of the BALL and the relapse setting of the B cell non-Hodgkin's lymphoma. These two are approved indication. Algorithm of the treatment is also very well defined, and that is available in the country now. So that is the most important thing. It is no more a experimental therapy. That is the most important message I want to give to the audience.
Thank you, sir. It's no more experimental. It's already been started. Thank you, sir. And so these many options are available to treat blood cancer, sir. So that is the reason you do personalized treatment for different blood cancer, nothing but precision type of therapy, right, sir?
Yeah, yeah. So you have to understand the disease, understand the biology, understand the age of the patient, obviously the financial limitation of the patient, and then plan the therapy. To go ultimately goal is to cure the disease, right?
Yes, exactly. Sir, you earlier you talked about India is most densely populated country, so that is the reason cancer incidence trends are also more. In the same way, sir, when this much person mean to say the most populated area, the one thing comes into the mind is accessibility and affordability, sir, in India. So, how far these treatment or these diagnosis or screening methods are affordable and accessible to the people, sir? Body.
Yeah. So let me answer the question is little differently. You know, I travel very extensively out of country, like in the
Yes,
different countries of Africa. I go
we
to
know.
Bangladesh very frequently. I see the importance of the Indian drugs all these countries. So remember one thing: we are very lucky that we are born in India. Remember that, and we should be very proud
Yes,
about that. Indian
exactly.
pharma has an amazing strength. So
Yes,
Indian generics are really powerful. They are very good quality drug. At the same time, you are getting in a much cheaper rate what the innovator
yes,
provides you. So that helps to treat larger number of population of the patients in our country. So I always go at their meetings and see there are three type of India. I'm telling you, it's a very good question you asked me. One type of India, which is 5% population, whatever they want to do, they can do everything. Adanis, Ambanis, whatever they want to do, they can do everything. There are another 10 to 15% populations. They try, they do most of the time. Sometimes they can't, like that. And another significant amount of populations who can't afford anything. So India is a place which needs a perfect amalgamation. The capital oncology, I call it the capitalist oncology and the socialistic oncology. We need to mix both. Like you know, in India now, in our hospital, Fortis Hospital, we provide all sorts of government sponsored programs like CGHS, ECHS, Mumbai Police, Port Trust. These are all government funded PSUs, right? Where the
yes,
treatment
sir.
is almost free. So we need to,
Exactly.
this sort of patients, some of our government hospitals are very over the patients burden and numbers. So there is a good amount of private and corporate partnership, and the government partnership is going on throughout the country. Many of the hospital chains are following that. That helps to treat a lot number of patients in our country, but we need to increase this net much wider so that we can treat much more patients. What you are talking about is extremely important, but I'm talking in a very different way. If you ask anyone, do you have TV in your house? Yes, I have a TV in your house. Why you have a TV in your house? So they will say that TV is not a luxury anymore. AC is not a luxury anymore. Fridge is not a luxury anymore, right? But at the same
Yes,
time, health insurance is also to be taken very seriously. People should penetrate and people should do the health insurance and they should spend significant amount of money, whatever they're earning for the health insurance purpose. So people totally ignore the health insurance part in our country. When they are earning money, they buy new flat, new car, everything new they want, but they don't look into the health insurance because they believe nothing can happen to them. But
yes,
that is an extremely important concept. So you have COVID taught us a lot of about the health insurance and the health related things. Definitely, COVID was a very good teacher, I believe. But believe me, that still the health insurance budget. I see a lot of affordable people, but still they don't have any amount of health insurance, or whatever the health insurance amount is there, that is just a very, very small in amount. So these patient people has to be more aware of that. People has to spend more about the health infrastructure. People has to spend more about their health. It's a very complex country. If any senior citizen you to talk about blood cancer, you need this sort of treatment, they always think about that. What will happen to my daughter? What will happen to my son? What will happen to my daughter's marriage? What will happen to my son's marriage? So it's a very complex socio-economic country we are in. But we have to move, and we have to think, and we have to take care of our health first. If you are happy, then only you can make your people.
Excellent. Sandesh, are you there?
Yes, Sandeep.
You are also facing the same problem. You can't see the doctor, sir?
Yes. Might be like doctor received some call due to which like
Sandesh,
yes, yes, I'm here. Hello.
same problem. Huh? You can also not see the doctor, na?
Yes, yes, yes.
The
We
doctor
are
was
waiting.
explaining very nice.
Yeah.
Sir has involved very nicely. Yeah, shit.
Hello,
Sir. Sir, it was
hello.
really. Hello, sir. We can hear you, sir. We can hear you, sir. Sir, it was really going very well, sir. Uh, Thank you, sir. So we were at top. We were talking on this.
Can you hear me now?
Yeah, it's clear, sir.
Yeah, yeah.
Thank you, sir. It was really going well. The content which you are explaining to the audience, the
I
message
can't hear
is
you.
very clear.
Sandeep, I can't hear you.
Sandesh, can you hear me? Should I log in once again?
Dr. Subhaprakash, are you able to hear us?
Sandesh, can
Hello.
you hear me?
Yeah, Sandeep. Dr. Subhaprakash, are you able to hear us?
Sandeep, I can't hear you.
Sir, one second, one second.
Uh, Sandeep, we are able to hear us.
Can you hear me? Because I log in because sir is not couldn't able to hear me. So should I log in once again?
Try it, like join it again.
Sir, just give me 2 minutes, sir. We'll end the session within 2 minutes. There are only.
Hello, Dr. Subhaprakash, are you able to hear us? Hello? Hello?
Sir, can you hear me now? Sir, can you hear me?
Hello?
Yeah, hello, Sandesh.
Yeah, Sandeep, like I believe like we both are like able to hear us each other, but Dr. Subhaprakash is not able to hear us.
Sir, can you hear me?
Maybe he is joining again.
Yes. We are at the last part of the questionnaire.
Yeah, sir is here. Hello, Dr. Subhaprakash, are you able to hear
Yeah, I
us?
can hear you now.
Okay. Yeah, Sandeep, go on.
Sir,
Sandeep, are you talking? I can't hear you.
Sandeep, please say something. So, sir will check whether like they'll be able to hear you or not.
I am able to hear you.
yeah.
Yeah, I can hear you,
Sir,
Sandesh, but
can you
I can't
please?
hear Sandeep. I
Sir,
think there's
can
a
you hear me?
problem in the Sandeep's end.
Uh, Sandeep, say something.
Hi.
Yeah, we can't hear Sandeep. I think
Hello.
problem in the Sandeep's end.
Sandesh, can you hear me?
Yes.
I'm in the office only. It's Wi-Fi connected. Sir, can you hear us now? Sir, can you hear us?
No, we can't hear you, Sandeep.
So, Sandeep, can you please like ask the last question so that I can ask the same question to Dr. Subhaprakash? Will it work?
Okay. You can work. No issues. Just last one strong advice for our audience. That's it.
Audience.
Strong,
Okay.
powerful message.
Okay. So, Dr. Subhaprakash, like Sandeep is asking for the like last one advice for our audience.
Yeah, so most important is that the blood cancer is curable, blood cancer is conquerable, and you get any non-specific symptoms that I told you. You are getting fever, which is not subsiding with the standard treatment. You are getting very fatigued or tired. You are getting some bleeding, like a gum bleeding, nose bleeding, spots over the body, or you are getting some swollen glands. You are getting some significant loss of weight, loss of appetite. You are not able to eat food. Then please don't ignore yourself. Do a simple test, what is called CBC, complete blood count, which is available everywhere in the country. And if there is any abnormality in the CBC report, please consult either an MD physician or a hematologist.
Thank you, sir. Thank you. Thanks for your valuable time and sharing your thoughts and experience into hematology. Thank you very much, sir. Sandesh, you can tell, sir. Thank you. No issues.
Okay, thank you, Dr. Subhash Prakash. Like it's been like great. Like you'll be like joining for this session, and like it's a very enlightening session, and we look forward for having more session like this.
Yeah, thank you, Sandeep. Thank you, Sandesh.
Thank
Bye.
you, sir.
Thank
It's
you.
always
See
pleasure.
you.
Thank you, sir.